Hello and welcome. Today we're delving into the world of ophthalmology to explore a relatively uncommon, yet potentially serious eye condition, pseudomembranous conjunctivitis. Join us as we uncover its causes, symptoms, diagnosis, treatment, and more, to gain a comprehensive understanding of this condition. So, what exactly causes pseudomembranous conjunctivitis? This condition arises primarily as a response to significant inflammation of the conjunctiva, the clear membrane that covers the white part of your eye, and the inner surface of your eyelids. Common culprits include severe bacterial infections, such as those caused by Streptococcus species, or viral infections like adenovirus. Chemical injuries to the eye, Stevens-Johnson syndrome, and certain autoimmune diseases like cicatricial pemphigoid can also trigger this inflammatory response, leading to the formation of the characteristic pseudomembrane. To understand pseudomembranous conjunctivitis, we need to look at what is happening on a cellular level. The intense inflammation triggers an exudative process. This means fluids, fibrin, a protein involved in blood clotting, and inflammatory cells leak out of the blood vessels in the conjunctiva. These substances then coagulate and deposit on the conjunctival surface. This deposit is what we call a pseudomembrane. It adheres loosely to the underlying conjunctiva, unlike true membranes, which are more firmly attached and result in more significant tissue damage upon removal. The formation of the pseudomembrane further irritates the conjunctiva, perpetuating the inflammatory cycle. Pseudomembranous conjunctivitis, while not incredibly common, can occur across all age groups and demographics. Its prevalence is closely tied to the underlying causes. For example, outbreaks of adenovirus infections can lead to clusters of cases. Individuals with compromised immune systems or pre-existing autoimmune conditions may also be at a higher risk. Accurately tracking the epidemiology requires considering the varied causes and the populations most susceptible to them. The signs and symptoms of pseudomembranous conjunctivitis can be quite noticeable and uncomfortable. The hallmark is the presence of a whitish or grayish membrane on the conjunctiva, often described as looking like a thin film. Patients frequently experience redness, excessive tearing, pain, a gritty or foreign body sensation in the eye, and photophobia, sensitivity to light. In more severe cases, there may be swelling of the eyelids and even blurry vision. The pseudomembrane itself can cause further irritation and discomfort. Diagnosing pseudomembranous conjunctivitis involves a thorough eye examination by an ophthalmologist or optometrist. The presence of the characteristic pseudomembrane is a key diagnostic indicator. The doctor will carefully examine the conjunctiva and may attempt to gently peel away the membrane to assess its attachment. Additionally, the doctor will try to determine the underlying cause. This may involve taking a swab of the conjunctiva for cultures to identify any bacterial or viral infections. A detailed medical history and consideration of any systemic diseases or chemical exposures are also crucial for accurate diagnosis. While we don't categorize pseudomembranous conjunctivitis into distinct types, it's important to classify it based on the severity and the underlying cause. The extent of the membrane, the level of inflammation, and any associated complications help determine the appropriate treatment approach. Furthermore, identifying whether the cause is infectious, inflammatory, or related to trauma is essential for effective management. The treatment for pseudomembranous conjunctivitis is multifaceted, focusing on both removing the pseudomembrane and addressing the underlying cause. The pseudomembrane can be carefully peeled away by an ophthalmologist, often with the aid of topical anesthesia to minimize discomfort. Topical corticosteroids are frequently prescribed to reduce inflammation. If a bacterial infection is identified, antibiotic eye drops or ointments are used. For viral infections, antiviral medications may be considered, although the focus is often on supportive care. In cases related to autoimmune diseases, systemic immunosuppressants may be necessary. Lubricating eye drops and cool compresses can also provide symptomatic relief. Preventing pseudomembranous conjunctivitis largely depends on avoiding the underlying causes. Good hygiene practices, such as frequent hand washing, can help prevent the spread of infectious conjunctivitis. Wearing appropriate eye protection when working with chemicals or in environments with airborne irritants can prevent chemical injuries. Prompt treatment of underlying autoimmune conditions can also reduce the risk. Regular eye exams can help detect early signs of inflammation and facilitate timely intervention. The prognosis for pseudomembranous conjunctivitis is generally good, especially when the underlying cause is identified and treated promptly. In most cases, the inflammation resolves, and the pseudomembrane disappears without long-term complications. However, in severe cases or if left untreated, complications such as scarring of the conjunctiva or even damage to the cornea can occur. Recent research is focused on developing more targeted anti-inflammatory therapies and improving diagnostic techniques for early detection of the underlying causes. Studies are also investigating the use of novel biomaterials to promote faster healing and reduce scarring after pseudomembrane removal. As we continue to advance our understanding of this condition, we can look forward to even more effective treatments and improved outcomes for patients with pseudomembranous conjunctivitis.